Good evening, good afternoon, and good morning, everyone. And today is the 1747th day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. And today's our guest is Dr. Mahavir Bansilal Ghiya, who is an MD homeopath, PhD, and also MA in Psychology and Public Administration. He is professor and HOD at in Department of Homeopathic Repertory at Government Homeopathic Medical College and Hospital, Detli, uh, Patan, Gujarat. He is also a member of Institute Core Committee, Scientific Committee, and Ethical Committee in Government Homeopathic Medical College, Detli. He is also a representative of Clinical Board of Studies at Veer Narmad South Gujarat University, Surat. He is also a member of Faculty of Homeopathy in Veer Narmad South Gujarat University and also a member of Noble University, Junagadh, Gujarat. He has a rich experience in research also. He has published more than 12 articles in UGC approved and peer reviewed journal. He has been awarded as the best young dynamic teacher in repertory from Maharashtra Homeopathic Doctors Association on 5th March 2017. He has also actively participated in teachers workshop at CN Kothari Homeopathic Medical College and Research, Vyara, Surat. Also in reorientation training program at ML Dhaule Memorial Homeopathic Institute, Palghar. And today's his topic is about introduction to research for budding homeopaths. So let's welcome Sir Mahavir sir.
Thank you. Thank you. So I'm audible to everyone?
Yeah, you
Yes.
are
Give me
audible.
confirm. Good evening, sir. It's very privileged to see that you are sitting in front of me. It's really very privileged. We have learned so many things from you. So thank you to this forum once again for giving me the opportunity in a very short time. I'm just sharing my work with you. So I hope the screen is shared with everyone. Just I need a confirmation.
Yes, sir.
Yes, sir.
Okay. So purposely I had taken the topic of a research, which is a backbone of development of every science. And actually this has been done as a mandatory part of academic activity only, as a part of what we can say that assignment as a part of internee training, then as a part of post-graduation, what we are doing for to get the homeopathic postgraduate qualification either in any of the subject. As a mandatory part only we are doing it. But when you see from the real experience point of view, then it's a really very, very interesting things. We are scared of so many terminologies and different techniques which are used in research. So through this seminar, through this webinar or through this interaction, my intention is that to get well versed with all these terminologies and to get simply acquainted with whatever the activity done in the research, and that is to be very especially for these young doctors, because they have the capacity. I think everybody has the capacity to think out of box, but I think curiosity is more as your age is less. So to enhance your this curiosity, or to have boost your questions which are there in your mind, you can prove them scientifically. And that scientificity, what is needed is that is nothing but the research. So I will proceed with that. These are my just little introductions. For today's, at the end of today's session, I am very sure that everybody will came to know that what exactly the knowledge is, how this knowledge is get created or gathered, then what exactly the research is, then what research methodology is, and why the research is needed, and what to do of that research ahead. So I'm very sure that if you patiently listen to all these things, here participate in all these things, we are able to get all these outcomes. Now coming to the knowledge, in just my recent webinar also I talk about what we know everything is not as such the knowledge. When you see the scientifically, we have two things with us. One is the belief and one is the truth. Somebody says that we listen, and that is in our belief. We have not able to see whether it is true or not. And something are truth, though we have not seen, but still we believe that yes, it is there. Say, for example, North Pole is there, South Pole is there in the earth. Now, everybody has not gone to that pole to see that is whether it is there or not, but we know that this is the truth. Then what exactly the knowledge is? Knowledge is this: when any belief or any truth, when you verify them, you have a concrete evidence for that, then that becomes the knowledge for us. If you see the development of homeopathy, it was just a written statement read by Dr. Hahnemann, that if that China has been taken in a crude form, that is, it has a capacity to produce the intermittent fever-like symptoms, chills and rigors, and that is why it has to be used as a therapeutic agent as far as Cullen's materia medica is there. So what it was written may be true, may not be true. So what Hahnemann thought, that let me prove it. And if you see on that verification, now this whole community as an homeopath, we are getting together and we are listening to the webinars and all those things. And that homeopathic knowledge is created by verification. And this verification is one of the a backbone of every science, not for homeopathy, but for every science. When it has to be grown, it has to be popular, it has to be expanded in all dimensions. It needs a verification at every juncture. And thus, all this verified knowledge gets gathered. Then we form the chest of the knowledge, the stock of the knowledge. Now, that knowledge, whatever we are having, is not enough. It has all the dimension of expansion in day-to-day life. But unless and until it is verified, we can't say that it is a true knowledge or it is a real knowledge. It may come just as in our belief system. It may come only as the generation truth which is going on with us. And there comes the role of research. Now, if you see what exactly the research is, it is just a formal work. What we are doing day-to-day work, it is that only. But only thing is that it is added with some specialities. It is added with some very characteristic. And the first characteristic is systematically. Whatever the formal work we are doing, it has to be done with a very systematically. And it should be purposive. We have certain things in our mind to explore, and so that it will increase our knowledge. And when we increase this, we will increase new things into the existing knowledge, then that can be applicable to everyone. And that is why we say that this stock of knowledge is to be devised to new applications. Okay? So if you see from homeopathic literature only, when the lycopodium was proved, we have some set of symptoms. But as the proving clinical utilization of lycopodium goes on, so many important characteristics has been developed, which was not there as a part of pruning. Very known symptoms of lycopodium is that time aggravation, 4 to 9 aggravation. That has been very nicely come as an important features of this. 11 a.m. fasting, can't stand, get hungry at the 11 a.m. These of the sulfur, these are also the clinical symptoms which are come from this again and again verification. Then they becomes the chest of knowledge as one of the characteristic features of those drugs. So like that, the things go on increasing. So for the research, it's very simple, in a very simple form. It is just a systematic work that is to be taken with some purpose. And when that purpose comes, so we add to some knowledge or clarification of some knowledge, and that we can use as the application for everyone. So this activity is unending. So when you say that you as a part of research fraternity, so that program is unending. Since the science has developed, still newer and newer discoveries and newer expansion is always and always going on. And same thing is true for homeopathy also. Though we have used sulfur, but we can't say that sulfur has, now we have the enough knowledge of sulfur. Still the things will go on increasing and increasing as the disease phenomena increasing, various diseases are increasing, the diagnostic technologies are increasing, right? So to combat, to be at with the match with the time, we also has to be matched. And hence this activity is unending. Usually what happens as an academician and when you pursue the research up to our degree level or up to the secured level, we follow it and then it should get left out. But I expect from this budding homeopath that once you get interested into it, it should be our lifelong activity, because everywhere you can do the read. Not necessary that while just doing your post graduation or gets pursuing your higher qualification like PhD or any other. Now specialty has also has been recognized by NCH in homeopathy. For that purpose only it is not needed. In a clinical setup also, you can have that aptitude, that inclination, and if you follow the steps of that research methodology, then we are very sure that you are able to add to this homeopathic science. So this is an endless journey till end of the time you can go. So always research is there to discover the new knowledge. Whatever we are having the end, whatever the black areas are there, gray areas are there, where we are blocked, we don't know what to do ahead of this. Right? To explore those areas, we can undergo the research. So research is the process. It discovers the new knowledge. It finds the answers to the questions. Now, if you see the materia medica, many of the drugs, how they come for the proving. I was just imagining that we have the hundreds, thousands of species of vegetables. So how we will systematically start proving one by one. But when I go into the history, they have observed that which are the medicines, which are the herbs, which are the in the conventional way, what are the substances used as a therapeutic point of view. Then they have tried to prove, they have seen that there is an efficacy from the other point of view. They have, but homeopathic doctors, they have thought that it can be proved, it can be prepared from the homeopathic point of view through the trituration, succussion, or in a dynamic form these medicines are to be proved. And then they have find out, doing the proving, and they are expanding our knowledge. So whatever the medicines we have seen, they have their some applications in their, means routinely at the local places level or in the other systems of medicines, we get some traces, and based on the traces of knowledge, we verify that whether I prove this from homeopathic point of view, what more I am able to get it. Okay? So many things you might we might be knowing that they are initially they are used, they are in their traditional practices also, but only from the homeopathic point of view. When we derive such questions and when we follow them with a systematic way, then we are able to use them for our purposes. So every research has two parts: find out and again finding it out. Okay? So find out, already it is there. Arnica was used initially also for the injuries also, as an external application, or they are tying the leaves of this arnica or the juice of the arnica on these injured areas. It was there, right? But when again we are proving them from the homeopathic point of view, and when we observe the symptomatology, like sore, bruise feeling, not able to touch, not allowing patient to touch, so that becomes a homeopathic knowledge. So though the things has been find out, again we are finding from their new dimensions or to increase their dimension. When we use this, then we call it as a research, which denotes that we are taking up the activity to look into the aspect once again, or we want to look for some new information about the something. Many times what happen, whatever the data is there in materia medica pura, whatever the data in the hearing guiding symptom, if you match these two data, many of the symptoms are much more in the hearing guiding symptoms, and they are just given by two thick mark, one thick mark, two light line, one light line. That shows the ability to produce and cure that symptom. So from where this cure has come, when we utilize that in a given condition, then and only we are go on increasing to find out that what is the affinity of this to it. And that is how, when the materia medica develop further, then we develop the new area, that is a sphere of action, pathogenesis of drugs. So if you are not able to see such a data in the very earlier materia medica, it is come afterwards. When we grasp the whole phenomena of the that drug pathogenesis, then we are able to find out there are certain drugs, medicines have affinity for certain organs, certain medicines has ability to produce such and such pathologies, right? And these pathologies can afterwards, from the Boger's point of view, they become a pathological generals. Some general alterations of the human beings dynamically, not to the pertaining part, become a generals for the Kent, and they become the guiding post for using that remedy in our therapeutic practices. This is how we are expanding our knowledge. This is what the research is. Now, what should be the qualities of research? What are the things when they happen in this way? Then only we call it is a research. It is a pre-arranged. It is a structured inquiry. So if you say that if you have taken the admission for the post graduations, or if you are doing any taking any research activity for your maybe for monetary gain, or maybe getting grant from some scientific community, they want some proposal from you, and that proposal means you are planning. So that is the first quality of any research. So haphazardly you can't do the research. There has to be some pre-arrangement, pre-planning has to be there. That what you are going to do, then what you are going to do, what way, means all the things you priorly you have to set up, and hence it is called as it is a structured inquiry, a formal step-by-step method or a sequence to take up the research activity in a developed to ensure correctness of data and validity of the process. So this is a very important aspect of any research. Whatever you are doing, it should be so crystal clear that using that same process can be used by any different other person. And that is why what you are writing as a proposal, or a systematic way by which how you are conducting the inquiry, it should be in a very, very simplified way, understandable way, and in such a way that whatever you are doing, it can be assessed for its validity also, that what you are doing is the right one, or it can be similarly done by any other person. So that is one of the very important quality of any research. Many times we say that many homeopaths are there which has the age-old experience. They are telling us that yes, this medicine is used in this. I had the experience of this lachesis. In any lachesis to be used in most of the cases where artificial menopause is there. If this is just my statement, because I had seen in my practice that these are the happening. Any uterine pathology, when the hysterectomy has been done, and afterwards whatever the elements has come, if it is really traceable to that origin, then lachesis gives the wonderful results. This is just my statement. But unless and until I take into consideration a certain specified data, I validate it in a scientific way, these cannot become a part of knowledge. So this is my just own experience. But if I want to share it as an experience for the science, then it needs to be gone through these qualities. So whatever the elements I had collected, it should be collected in a proper way. It is to be documented. It is to be shown. Then it becomes the important aspect for the as a part of research. Scientific method consists of systemic observation, classification, interpretation of data. So this research has its own way of validating the things, its own way to find out the things are happening due to your intervention, due to your application of medicine, or because by chance also it is happening. So that they are able to find it out. And for that purpose, in the research, statistics things are there. These statistics are able to tell us whether the changes which has occurred is due to your intervention, or it is by chance, or by just the natural way. If it is happening with the natural way only, then your medicine is of no use. So that statistical test also we must be able to confirm through it, and that shows its variability. Okay? And then this validity method establish the result obtained. You might even heard this p-value. So that p-value is nothing but our the mark. If it comes less than that or more than that, it has its own different interpretations. So it is a structured inquiry, and whatever we are doing, it should follow a very definite scientific path. That is the first quality of any research activity. Then next quality of research is that it utilizes the acceptable scientific methodology to solve the problem. Now, if you see that you might have been heard that sampling is there, you have to collect, random sampling is to be done. You should not take only the things which are in your favor. Okay, so whatever the patients are there, everybody should have an equal chance to get participated in the participation. And when you follow this, then that becomes a scientific methodology. Right? Then whatever the result comes, they have the validity into it. So whatever you are doing the inquiry, it should be on the scientific methodology. And hence we say that research is not the research, it is a research methodology, because it has its own program. It has its own way of doing many things. We'll came across this as we proceed. The next quality comes that it should create a new knowledge that is generally applicable. The outcome should be such that they are not specific to the particular issue or situation, but needs to be generalized for application to comparable issues. So what it means that whatever you are doing, it should be such a transparent that wherever you apply that, the same result should come out. And that is what exactly the science is. Science is what? That when you say anything, when you hypothesize anything, when you confirm anything, it should be universally true. It should not be at only a local juncture only. That is it. We say that our drug totalities are the truth irrespective of geographical totalities. Means where anywhere you prove any of the medicine in any of the worldwide, you will get the same set of symptomatology. It means they are not affected by this geography and all those things. Modality may vary, but the general features are like that only. And next, the qualities of research is that it is a creative process to develop better understanding of mankind, social, culture, economical issues. This is the overall. This may not be pertaining to a very specific homeopathic aspect, but it should be the enlargement of not only the scientific community, but for social community also, cultural also, economical also. You might even knowing that many surveys are taking place. Initially, when the antipox treatment has been started, the medicines are given to the patient at his disposal only. 1 month medicine are given to him, but still the result or declining rate was not there. Then this antipox treatment, they have developed a different regimens, right? So it is not just searching the medicine, but to get the effect also. That is a social and economical issues there. We are utilizing so many funds for these medicines and for the treatment of these, but still there is no decline in the rate of this tuberculosis. Then why this is happening? For that also again the systematic study has been created. Then loophole are find out that medicine if given to the patient, they are not taking the regularly medicine. Some day take, some day they doesn't take. So what to be done? So they have taken direct observation treatment. The patient should come in the center in front of the medical officer. He will take the medicine and he will go back. And then again next day he will come. That is a direct observed treatment. So like that, different things has been added. Right. So these are also the part of research only. Then it should be useful to others who wish to apply the findings in developing the new policies, application of findings. It is for the benefit of the public, and this is the really the great what I can say, that the great satisfaction that we are able to whatever we are science we are using, and we are able to give something back to it, so that can be it can be applicable to whole of the humanity. That gives an immense pleasure for that, the unconditional happiness what we call it has the capability to give you that. And so I think that everybody should get inclination to do some research and to get some new knowledge so that it can be applied everywhere. Right now also we have so many blogs with us, right? We say that arnica is the best medicine for hair falling, but unless and until we prove it scientifically at what way, in the practice we are getting the results, but through the methodology, unless and until comparable, if we are not able to show, then its popularity won't be over there. So these are the qualities of a good research or a best research. Now we will switch on to the next, that is the different types of research. Now this is a very confusing thing for all the doctors and these new researchers, that why every book is talking about the different varieties of this. Now these different types of research is based on the utility. Either you are using to explore the basic, either you are using it for using the application of this, right? If you want to find out the cause of any new disease, then you go retrospective to find out there which are the patients who have developed these, what are their things, what are their lifestyle, right? So that is a descriptive one. So like that, there are varieties of types of research, but what is required for this homeopathy more is or the clinical research, and in that this analytical we need more and more. because we have many established facts. Now only we have to prove them in the scientific point of view. That is the only things. Right? Otherwise, the fundamental decision already has been there. You can't prove again and again similar. That is fundamentally truth. We have observed it again and again. Now, whatever our different medicine, whatever the different approaches, that we have to widen it out. Whatever the difficulties we are facing, that needs to be widened out. So as far as this different type of research, as far as the task you are taking into consideration, accordingly you can decide that what type of research it will be there. It is just a mere classification that you should not select it. When you do the activity, that activity will fall among some type of research. So you should not bother about what type of research I am doing. If you are doing a systematic research, it will fall in some of the category. So I just assure to these all these budding homeopaths that they should not much bother about what type of research they should follow. That is not the thing. You just identify the question, identify the areas, identify the issue on which you want to work, and for that work, for that problems, what way the solution can be done, that methodology only to be followed. So don't bother about as far as this type of research is concerned. What are the purposes of research? Again, whatever the qualities we are talking about, the same way, there are definite purposes of this research. Haphazardly, we can't follow any of the things. Right? So to get familiarity with the phenomena or to achieve the new insight into it. Like we know that homeopathic medicines are acting. Theoretically, we are able to tell them, yes, they stimulate the nerve ending, and then that nerve ending goes to that whatever the neuroendocrine assay is there, and then the healing start. So this is theoretically very true. But if you do some integration with some of the basic science persons, and when we are able to show this by applications of new technology and all these things, then that will be the better purpose of this research, to get familiarity with the phenomenon or to achieve the new insight. Here is taking place, but what way it is able to take place, that you must be able to show, right? Just like a nanoparticle, one article was there, right? So like that, there are different things can be possible in a different medicines to show their efficacy in any of the area or the general utility that we can show. That should be our purposes, right? When I see these all these PGs dissertations or their research proposals, we don't have that high degree of targets. We are just utilizing using the things which are already we have proved that yes, Kent repertory is useful, that everybody knows. But again and again, we are go on showing the utility of Kent repertory like that only. We have to go ahead of that. Then to portray accurately the characteristic of particular individual situation or group. So these are the general purposes of research. If I talk about the homeopathy, we also want to explore the efficacy of any medicine in certain areas, or we want to increase the efficacy by identifying some certain characteristic features. If they are there, definitely this can be used much more and more and more. This is what our interns are all are doing. We are giving them such a groups only, that I will share you with some of these proposals and what way the things goes on. But really, if we keep these purposes in our mind, then our travel, our path, our journey is fruitful. When we find out few more to determine the frequency with which something occurs or with which it is associated with something else, when you want to find out the correlations, that correlation, as far as homeopathy is concerned, generally the correlation we find about the susceptibility and the dose of the medicines, right? This is theoretically we have established, but unless and until clinically we prove that these are the level of susceptibility, these are the potencies we have used, and then whatever the result comes, though the potency is high, potency you have and susceptibility is low, what happens? It gives a desired result or not? That needs to be scientifically proved. Many times we say that coffee is not to be used while taking the homeopathic medications. Some doctors say that no, I had given the medicine along with the coffee, still I get the same results. Right? Now we need to find out whether really coffee is having any role, any aromatic things is having any role on in these or not. Right? Usually we should not think that whatever Hahnemann has written is now fixed. Hahnemann was not, he was also a scientist only. He has also proved many of the things, and then only he gave us the idea from his experience only. I really wonder about his statement that what is homeopathy when he says that it is a medicine of experience. Unless and until you have the experience, you will not understand what homeopathy is. Means he is also in the part to do something, just not to believe what is written. It should be the part of your experience. And exactly research gives you that idea. When we go ahead to find out the purpose of research, it tests the hypothesis of causal relationship between different variables. Now, as far as this homeopathy is concerned, we can have a lot many variables: susceptibility, diathesis, medicine, agents, certain group of remedies for certain disease conditions. All these are our variables, and these variables we can utilize, and we can definitely do the research taking these all things into the considerations. So for us, variables are these things, right? Still, if you go ahead to find out the purpose of research, research aids planning and thus contributes to the national development. Research, social science, research in particulars. Now, if I talk only about the homeopathy, unless and until we or go on proving us the economic benefit of by taking homeopathic treatment, the economic burden will less, the government will not give so much thrust on the homeopath. It is our duty to show us that yes, economically, homeopathic treatment is very cost effective as compared to the others, and that way integration, we can tell that integrated science is needed for that. Homeopath will have the more role into that, and if we do this such a activity and if we convince, then it has the more and more benefit for the homeopath. You might have been, if all these interns or young doctors are knowing the different policies, that healthy mother and happy child, you might be knowing there the government has given the homeopathic the role to take care of this anemia, right? During ANC, and that also, because that was the important reason to have the anemia in this children, these malnourished children and these females. So, right? So that also need to be explored, that at what level we have reached, so that in the same national role, national policies, we are giving role to intervene or not. That depends on us. If we follow this research guideline, if we follow this, then we are able to achieve, and we can say whatever we want to say. It is just not just by our own experiences, but through the scientific methodology. If we are able to prove, then definitely the national policies, we have a major role will be there. So that is also the big purpose of our research, that should be. Now, through this, I am very sure that you are in a position to understand what exactly the key factor the research carries with it. So research carries a systematic and critical investigation into the phenomena. That is the first important characteristic. Then it is not mere complications, but it is a purposive investigations. We have some dilemma in our mind, and that dilemma, through logic, not only through the logic, but through clinical experiences, we want to solve it. We want to find out the solution for that. So this is the second thing, which is a strong characteristic of research. Then while doing this, we have to follow a known scientific method. It should not be by our own methodologies. There are certain scientific guidelines to do these things that needs to be followed. It is the objective and logical applying possible tests to validate the measuring tools and conclusions to be reached. So whatever the effect you are able to observe, their effect are to be measured by some standardized tools, right? Say for example, you are very sure that by the application of Berberis vulgaris, stone is size is decreasing, and afterward it get dissolved. How you will came to know that? How you will measure that stone size is reducing? What are the scientific tools you are having, whether they are validated or not? So ultrasonography, yes, it is one of the best tool to use this, but there are so many disease conditions, so many things. for every radiological imaging is not possible. So for that purpose, there are various different scales are available. I will show you some of the scales in different conditions. That also we can utilize. In many cases, permanent cure is not possible, but we can improve the lifestyle of the patient. In many of the osteoarthritis cases where these degenerative diseases are there, in that also we can, if we are applying homeopathy and patient lifestyle is going to be improvised, that also to be utilized by using certain standardized measuring tools, and such tools are available. We should get acquainted with all those tools so that we can utilize them in this our systematic inquiry. Right? So it is a systematic inquiry, then it is a purposive investigations. It follows a very scientific and definite work, and whatever we are using the tools, the all tools should be scientific, right? So that there should not be any question in our work. These are the some of the very important characteristic of research. And apart from this, it is to be based on observative experiences, and these observative experiences can be repeatable. That one should keep it in mind. Research is directed toward finding the answer to the pertinent question. Not necessarily that every time you will get the positive answer, but if it comes to be a negative answer, still not to be worried. At least we can confirm, yes, this is not the way to get the solution, or this is not the fact what we are thinking about. It is it emphasizes the development of generalization. Yes, whatever you are able you are to find it has the capacity to be generalized, to be applied for all the human beings or everywhere. That has to be there. They are the valid conclusions of every research. Now we will see how actual research activity is there. So now, just now we are just talking about what exactly the research is, what research means, what happens into the research. Now if we have make our mind to have, yes, I want to do some research really, then what the steps we have to follow? The first thing comes is a proposal. That I told you that it should be a structured activity. So for whole this research activity, how would be your proposals? Means how much duration you want, what are the things you will use, what you want to study, for that what are the intervention you are going to be used, for a measurement of your result what you are going to be used, right? Everything is to be written. Then time duration is to be written, in how much time you are going to be complete that. Then how many number of patients you are going to be evaluated for these conditions. Of course that will depend on what your research is. Usual theorem goes, for any survey you need at least 200 observations, and if you are doing any clinical research, as far as this theorem goes, minimum 30 samples to be needed, right? But to get the right scientific validating sample size, it depends on what disease you are talking about, right? Its incidence is how much, its prevalence is how much, and for that certain standardized formulas are there. And based on that, if you are taking so many number of patients and then you are doing your research, then it has more validity. So that all these things to be predetermined and to be written in a documents, and that we call it is a proposal. Research proposal is there. And after this research proposal, second comes when you finish your research, then whole data is accumulated at one place. Then we call it is a research documents. That is your final research document. If you are doing this research for the academic purpose, then we call it is a thesis, we call it is an assignment, we call it is a there are different names have been given for that. But as such, it is just a research document. And then comes that what to do with that research document. Now, this research document, just now we are talking about the generalization. Everyone should get knowledge of this. Every community should know that this thing has happened. And if they want to test it into their areas, they can utilize this. And so we call it is a publication. You have to publicly out all these things, right? So they are to be publicized in the form of scientific articles, or to be published in peer review journals, or to be presented into any seminar or in a scientific community, where through seminars it will reach to the rest of the people. So these are the three things which are needed for any actual research is there. Now I will show you some of these things. So when you prepare the proposal, first thing is the title, that what title you will give. There has to be a title. Generally, it is not directly the research question, it is just a title. And for that title, we had the criteria, scientific criteria for a title is this finer. Now, F stands for feasible. So whatever the research activity you are want to take, it should be feasible through man, through money, and through material. Okay? It should be feasible in your area, right? Because our hopes are very big, our expectations are very, very big. But you should see in your resources what are available to you. So that is feasible. It should be feasible to your area in terms of all these things. Then second is interest. It should be interesting. It should be create interest. As far as the scientific interest has to be there to see the things, because it should be unknown, it should be not very crystal clear, it should be gray, right? But it is needed, then we can call it is an interest one. Then it should be novel one. What your existence is already existed is there. If you are again retesting, so you are wasting all the resources. So it should be novel, it should add something new to the existing one. Then that is an real thing to do the research. Then it should have the ethical consideration has to be there. There should not be any human rights to be consolidated, animal rights to be compromised, right? So these ethical areas also has to be taken into consideration. You might be knowing that case control study where we are taking diseased person in two groups. In one groups we are giving medicine, and in other group we are not giving medicine. So we are not giving medicine, we are doing some unethical activities, right? So that unethical activity to be guarded with some things, that we are watchful. If any complication has occurred, we will refer to that person, right? So ethically, you should see that there should not be the hampering of any human rights, animal rights, right? So that area to be taken care. And that is why whenever you do any research, whoever the participant, we take their consent. And that is not just a consent, but we take their informed consent. Informed consent means we are telling them the whole story of this science, this research, in their tongue, in their mother tongue, so that they are able to understand it. And then we take their consent. Yes, for this purpose, I am ready to participate in this study. Okay? So that is ethically also it is to be validated. And then most important, it should be relevant. What you are doing, it should be relevant to grow the science. Then only that is an important as far as the research is concerned. And so we call it is this finer, FINER. That should take care when you find out, take out any topic, or you prepare the title of your research. Then in that research proposal, first title is you are writing, then you are writing some introduction. So in the introduction, what is expected, that what is the background, right? Why this research needs to be done, right? What are pre-existing norms are there, and why you want to explore this further. That is what the introductory portion is there. Because whenever we are thinking to do the research on it, there has to be need. So need of the time has to be expressed through that introduction. Then comes the literature review. That literature review, many times a research proposal contain or research proposal may not contain. But literature review means till now on that area, on that issue, what are the people has been done and till where they have reached. If they want to go further, we need some background. And when you collect all those background, and through that background, we are able to know the different research gaps are there. Somewhere somebody has not able to do that, and you are able to find out that gap, and to fulfill that gap you want to do this research. So all these things are possible when you very critically review this literature of the existing knowledge on that areas. Then comes that what research design and methods you are going to apply. So research design has its own importance, right? That whatever it depends on what is your title, or what type, what areas you want to explore. In that areas, what exactly the variables you want to test, depend on that the appropriate research design is to be selected. Then comes the aims and objective. This aims is nothing but whatever the title you are writing. But to achieve that aim, what are the different steps you are going to follow? This aims and objective is one of the very, very important aspect of your proposals. We will see that. I will show you some of the real life aims and objectives of this. Then practical implication, that is the methodology, what way you have conducted, right? What way you have selected the patient, then what way you have taken their history, how record has been kept, what way you have analyzed, when you have done the intervention, when you have not done the interventions, like that whole of the procedures you are writing. That is the practical implication. And in the end, you are writing all the references from wherever you have taken the help, through the magazine, through the literature, through the persons, through any website or through any instruments, through any using any scale, from wherever areas you have collected the data, that like that you have prepared the references list is there that need to be there. Now, why this reference list has an important? Because data can be verified, data can be validated, it can be again used, whether what is mentioned over there you have correctly interpreted it, followed it, or not, right? So this is the very interesting part of research, that everything is so transparent that whatever the proposal you have prepared, based on that proposal anybody can do the research, because everything is there in a black and white. That is the important of this research proposal. It is the systematic programming of the research what you are going to do. I will show you that also. Now, these aims and objectives are very, very important of any of the research, because research means you have some questions, and to solve that questions, you have find out some steps. So these steps are nothing but the objectives, and whatever the question is there in your mind, it is the aim. So it is said that a research aim is a broad statement indicating a general purpose of your research project. It should appear in your introduction, and at the end your problem statement. And objectives are nothing but the more research objectives are more specific than your research aim. They indicate the specific way you will address these problems. What are the steps you are going to follow? They are your objectives. I will show you in a real research proposal what way these objectives are reflected. So these objectives criteria should be SMART, like very specific, they should be measurable, they should be achievable, they should be relevant to the study, and they should be time-based. Right? Now, very specific means, say for example, you want to study whether really ferrum was given to the pregnant lady, it can increase the hemoglobin or not. This might be your passions. Right? So it should be very specific that what you want to do. I want to judge the hemoglobin level initially also and after also. That is your specificity, and what the intervention you are going to use is a ferrum phos, maybe China, whatever you may be, alpha tonic, or whatever the lecithin, whatever you want, but it should be very, very specific. If you say that by application of homeopathic medicine, if hemoglobin level is increasing, now this is very, very broad, right? So when you think about these objective criteria based on your title, come to the very, very specific level. Now next comes the measurable, right? So hemoglobin increasing or not increasing, you have any measurable event for that? Yes, we can measure the hemoglobin, right? By Sahali's method or whatever it might be, you in the gram percent or in a percentage. So it should be measurable. Whatever objective you are talking about, it should be measurable. So if they are not able to measure in a quantitative way, at least qualitative way also they can be measurable. That is to be used, right? So they should be measurable. You keep this in mind. Whatever the research idea you are getting, in that whatever the variables, whatever two things you want to see, they should be measurable. Now if you want to see say that in the by homeopathic medication pneumonia is curable or not curable, so here what is a measurable? Pneumonia is measurable, yes, through x-ray you are able to measurable, through its sign and symptoms it is measurable. If recovery is taking place or not, our homeopathic parameters, identified parameters are there, yes, through this it is a measurable. So these things are to be kept in mind. Then it should be achievable, right? One should not think that whether cancer is curable or not. The things which is achievable, whatever in your resources in your areas, accordingly you should think of your objectives. Then it should be relevant. If you are measuring anemia, very specifically iron deficiency anemia, then iron level and hemoglobin level is enough. It should be relevant. You can't go for the vertigo measurement and weakness measurement because they are not relevant now. When you are talking about the iron deficiency anemia, you should be very specific to that level of iron and hemoglobin, right? That is more relevant. And it should be time based. You should predict whether it should be 3 months or 15 days or 6 months, right? So depending on all the metabolisms, the recovery period, disease period, because pathogenesis, pathophysiology, physiology, everything going on. So it should be a time based. You can't take much more time for that than the required time as far as the natural course of the disease is concerned, right? So I hope everybody is following this. So these objectives and aims are the most important part of this. Then come the research design. So research design is talking you about how you will collect the data, how number of patients are needed for you, which patient you are going to include, which patient you are not going to include, what way the study will be there, right? So all these things comes under the research designs. And when you see the research design, it should follow these criteria. It should be the neutrality. It should not be biased or one way it is to be. It should be neutral. Like just now, initially I told you that whatever the number of patients are there, everybody should have an equal chance to participate in your study process. It should not be that only the if disease has started initially, that only you will enroll. If disease has crossed the 1 month, 2 months, 3 months, or gone to its severity much more, you will not include. That should not be there. All the defined diseases are defined disease people are there. Everybody should get equal chance to get in. So that is neutrality. Then reliable. Whatever the things you are taking into consideration, it should be reliable. It should not be your own criteria. It is scientific criteria has to be there. It should have a validity. It should be tested by anybody. Yes, it is there. When you say the criteria, anemia I'm taking if hemoglobin is less than 10 gram per cent. Now yes, this is a validity. Yes, below 10 only I will include it anemia. If it is not there, it won't be included. And then whatever you are able to do, it should be has a generalized capability, right? Everywhere it has to be there. For your own purpose, you cannot remove the criteria or lower down the criteria or increase the criteria. It should be whatever the generalizely everybody is using, like that it has to be over there. So this is about the research design, and there are so many things are available as far as this research design is concerned. But research design depends on whatever the study you want to do accordingly. Now just find very short time is there, so I will just go ahead. So once by going through all these things, now you have completed your study. Now result will come to you and you will write down the discussion and result. When you do all this study, you will get all the data, and based on that data, you will write some results and you will do the discussions and you will do the conclusion. When you write everything at one place, it means your dissertation, your thesis, your assignment, whatever the term you call, that is complete research documents. And when you complete this research document, these are the part of that research document: introduction, research, literature review, methodology, result, discussion, and conclusion. See, result and discussions are two different things. Results means what actually you have get in your study, that only to be incorporated over here. And when you come to the discussion, you are interpreting your result with the existing knowledge of literature, that somebody has found out this, you have found out this. Now what is the correlation, why this happens, whether it is opening new gate for the new research, like that it is there, right? So it is a different result, and discussion are a different things, right? Research means result means whatever your findings you are able to see in your study, and discussion means you are matching your findings with rest of the world in the literature who have done the similar kind of study, and you are taking some discussions on that, so that newer areas of new research comes up, right? And then you are sum upping all your study, that is a general conclusion. Now you have prepared, research has been done. Now what to do is to publish it, and that is the publication. Now this publication is a very different area, and in some time I will talk on that, right? Now I will show you some of the real life research proposals and research documents. Now, this is one of the research proposal I am showing you. This is the research proposal. Now here, what that research candidate has taken to study the effect of Justicia adatoda medicine in acute rhinitis through analytical, non-randomized observational study. The same study has been taken place at our place. This is the real life which has taken place. So here you see the Justicia adatoda is one variable, acute rhinitis is another variable. Now we need the measurement of all these things. So this was the title, right? Then the introduction, that what is the prevalence of rhinitis, right? Then this is the aims and objective. Now you see, if you focus on the objectives, what is the prevalence of acute rhinitis in our area, then how you will came to know that rhinitis has been decreased or not decreased. For that, how you will measure. So to measure that, specifically this rhinitis scoring control system was used. So by that, we are very sure to see that whether it is acted or not acted. In a comparative way, we can justify this, right? And to study the action of Justicia adatoda, that what are the symptoms available, which are strong features has been seen.
Sir,
Yeah, I'm concluding, sir.
Okay.
Yeah.
Just 1 minute.
Yeah.
So we can have second session if you need.
Okay, sir. Yeah, I'm just concluding. I'm just showing you this real life. Right? Then this ethical study. See, in the ethical study, what I was talking about, this consent from that is one of the important. So this is the inquiry of the patient, and this is this rhinitis score. So this is the measurable criteria, and that has to be over there. Right? So this is the consent form of the patient. We have to explain what we are going to study, and so voluntarily he will participate or not participate, right? And that is to be bilingual in the local language also and in English also, right? So this is the proposal, and the same study has been conducted, and we have published in a scientific journal, peer review journal also, same also. Sir, here I think I should conclude as the time is running short, and next time if any other thing is there, any real proposal, I will talk on that, right? So lastly, I just show you from where I had used all my study material, and I'm thankful to all these people, Dr. Sahani sir, Arpana madam, and my principal sir. And if any questions, you are free to write to me. So over to you, Dani sir. Thank you for giving me opportunity and listening so patiently to me.
Yes.
Thank you, sir.
And Dr. Rucha?
Yes, thank you so much, sir. Thank you, sir, Mahavir sir. It was a wonderful session. The way you explained almost all the things about research, and it will be very useful for the intern students and especially PG students. So wonderful session, sir. Thank you so much.
Thank you, all of you. Thank you, Dani sir, for giving me the opportunity.
Thank you,
Thanks to
Mahavir
you.
sir. It's really a very good session indeed. As Dr. Rucha Mavedia pointed out, it is really a very effective one. We need this kind of presentation in the future because we, as homeopaths, we are being criticized by some people from the other side, but we can show the world that homeopathy is the pure science. It is the pure science among science. That kind of research need to be done, and all of us can contribute to that also in that way. So it is the high time for the students to take it as a challenge and come forward and to obey the guidelines given by Ghiya and some other doctors in this forum. Thank you, Dr. Dr. Bansilal Ghaya sir. And
Thank you.
those particularly we thank Dr. Richa Mavedia for an excellent moderating session, and those who attend the session also. Thank you.